This video is about thyroid test and what are thyroid tests and what do they mean? Many patients come to me confused and apparently so worried about getting their thyroid blood test. They see words like TSH, T3, T4, antibodies, and no one explains what they actually mean. So today I'll explain thyroid test in simple language, what tests are included, what each test means, and how doctors use them together to make decisions. So, what is the thyroid and why it matters? Well, your thyroid is a small butterfly shaped gland in your neck. It has a huge impact on your body. It controls energy level, weight, heart rate, mood, body temperature, hair, skin, and digestion. When thyroid is off, your whole body feels off. Most important thyroid test is called TSH, thyroid stimulating hormone. This is the first and the most important test. Important point, TSH, thyroid stimulating hormone, is not made by the thyroid. It is made by the brain, pituitary gland. Think of TSH as a thermostat. If thyroid hormone is low, the brain raises thyroid stimulating hormone through pituitary gland. If thyroid hormone are high, brain lowers thyroid stimulating hormone. How to interpret TSH? High TSH, high thyroid stimulating hormone, means brain is producing more thyroid stimulating hormone, which is going to the thyroid gland and trying to stimulate production of more thyroid hormone, and that happens in hypothyroidism. When there's a low TSH, low thyroid hormone, and when brain is telling pituitary gland to produce less thyroid hormone, that happens when thyroid is overactive, like in hyperthyroidism. Free T4, that is the main thyroid hormone. This is the main hormone produced by thyroid gland. Free means the active form available to your body. Low free T4 confirms hypothyroidism. High free T4 confirms hyperthyroidism. We always interpret TSH, free T4 together. Active hormone, free T3, which is called triiodothyronine. This is the most active thyroid hormone. It directly affects your heart rate, energy, anxiety, weight loss. Free T3 is especially useful when symptoms are strong and TSH is borderline and hyperthyroidism suspected. Autoimmune thyroid test. Now let's talk about why thyroid disease happens. TPO antibodies seen in Hashimoto thyroiditis can be positive years before thyroid levels change. Explains autoimmune cause of hypothyroidism. Thyroglobulin antibodies, and that supports autoimmune diagnosis, also used in thyroid cancer follow-up. Thyroid is stimulating immunoglobulins that are specific for Graves' disease. These antibodies overstimulate thyroid gland and cause hyperthyroidism. The antibodies explain the cause, not how severe the disease is. So what happens? What are the common test patterns? So you have high TSH, low free T4, which is found in hypothyroidism. And you have low TSH, high free T4, and or T3 in hyperthyroidism. High TSH and normal T4 is found in subclinical hypothyroidism. And normal TSH and positive antibodies we see in early autoimmune thyroid disease like Hashimoto thyroiditis. That's your TPO antibodies. And so when should you get thyroid test? You should consider thyroid test if you have fatigue, weight loss, weight gain, hair loss, anxiety or palpitation, irregular period, fertility issues, family history of thyroid disease, high cholesterol without explanation. So remember this simple rule. TSH tells us there may be a problem. Okay, and T3 and T4 tell us how bad it is. And antibodies tell us why it's happening. Always treat the patient, not just the lab report. Thank you for watching.